Okay, we have mylohyoid, geniohyoid, genioglossus, tongue, lingual tonsils, palatine tonsils, pharyngeal tonsils. We have the inferior middle and superior nasal meatus, and our inferior middle and superior nasal concha. We have our sphenoid sinus, frontal sinus. Here is torus tuberous, and here is the opening to the auditory tube. This is salpingopharyngeus. This is tensor villi palantini. This is levator villi palantini. Right through here, at the level of the hyoid, we have our superior pharyngeal constrictor. At the level of the thyroid, we have our middle pharyngeal constrictor, and below here is our inferior pharyngeal constrictor. Here we have the anterior longitudinal ligament, which comes up to become the anterior atlanto-occipital membrane. We have our apical ligament here, the top of the dens, connecting it to foramen magnum. Spinal canal, of course, we have our posterior longitudinal ligament that becomes our tectorial membrane. And then on the anterior aspect of the laminal spinal junction, we've got our ligaments and flava. And then up here we have our supraspinous ligament that becomes ligamenta nuchae here. Ligamenta flava becomes the posterior atlanto-occipital membrane, which in some people calcifies is where you get your posterior punicus.
Which was what I have.
Okay. Here we have our mylohyoid. It's like a basket. Then we have geniohyoid, genioglossus. We have our submandibular, sublingual. This one's sublingual salivary glands. Here we have our buccinator. We have our masseter muscle.
I'm sorry, it's hard to hear you. Say it again.
This one's buccinator. This one's masseter muscle. This one's temporalis here. Again, inferior, middle, and superior meatus in the nasal cavity. These are our maxillary sinuses underneath the orbit, eye orbits. Here is our sphenoid sinus, and here's our frontal, part of our frontal sinus on these cuts. She also likes to tag the eye muscles on here. These ones are superior rectus. On top is levator palpebra superioris. Then we have our superior oblique. Superior oblique here. Medial rectus, lateral rectus, inferior rectus, optic nerve.
Okay.